Hi, I'm Dr. Diane McKeown and today I'm going to be demonstrating some dermal filler treatment. In times gone by we used to think of facial ageing as a problem with gravity, whereby gravity caused things to sink down the way. Actually what we've come to realise more recently is that that's not the case. As we get older, we lose volume from the face. What dermal fillers do is allow us to restore that volume loss by means of a relatively simple injection. And we can do it in virtually any part of the face, although it's typically best in the middle part of the face and the lower part of the face. Today we're going to be demonstrating the technique on Carol. Okay, so when we assess the patient for treatment with dermal filler, what I'm looking at initially is there anything on the face that stands out? What we want to create when we do any kind of cosmetic treatment is a nice, smooth, even look where all the features fall into balance with each other. We don't want any cheeks that are too big that stand out. Equally, we don't want any lips that are too big that stand out. And also, we don't want any deep lines or wrinkles that are big and stand out. We just want everything to form a nice, smooth canvas. When I look at Carol's face straight on, the first thing that my eye is drawn to is the lines that come from the corner of the mouth down towards the jaw, as well as the lines that come from the nose down to the corner of the mouth. The temptation is to simply fill those lines out, but doing that on its own is not enough, because we need to think about why does she have those lines in the first place. And the reason that she's got those lines is because she's lost the support structure in her face. And because of the loss of subcutaneous tissue here, we're talking about both fat and bone in this region, that's allowed that skin to fall down the way, and it creates these wrinkles and folds at the corner of the mouth. So the most important thing for us to do here is to restore the volume in the cheek, and we need to do that first before we start filling these lines here. So Carol is a little bit worried about having filler in her cheeks, as a lot of ladies are, because they're often very worried because they've seen celebrities who have had too much filler put in the cheeks. What we're trying to do here is not give Carol cheekbones that she never had when she was younger. We're simply trying to replace the volume that's been lost with age. And I think that's a really important distinction to make. We're not trying to create something that wasn't there to start off with. We're simply restoring what was there 10 years ago, 15 years ago. So the areas in the cheek where she's lost volume are quite obvious because you see the dark shadowing. Okay? And this particular pocket here, below the cheekbone, is where something called the buccal fat pad used to live when Carol would have been younger. Okay? And with age, that buccal fat pad gets lost. Now, the next way that I'm going to assess Carol's face is by turning it round into the oblique view. And when I look at the face from the oblique view, the ideal female contour should have a slight concavity coming down into the lower eyelid, slight convexity coming over the cheekbone area here, and then at the bottom part of the face, there should be a slight concavity here. After I've restored the volume loss in this region here, that will help to soften the appearance of the nasolabial fold as well as the marionette lines at the corner of the mouth, but it's not going to take it away completely. So I am going to restore some volume in this area separately. And I can also see something here called the pregial sulcus, and all that basically means is that we've got a bit of a collection of tissue here. And just in front of it, there's a bit of hollowness here. So that when we look at the face front on, rather than having a nice smooth junction between the lower part of the cheek coming down towards the chin, we've got a bit of shadowing and a bit of indentation. So I'm going to fill out that pregial sulcus as well. And again, my overall goal is to create a nice smooth result with nothing that stands out and nothing to interfere with the eye as it looks at the face. So I am just going to start off by doing a little bit of local anaesthetic to make the procedure as comfortable as possible. So there's a few areas that we need to anaesthetise. When we're doing the cheek, I'm going to use something called a small cannula, which is only going to have one small needle entry point here. So I'm just going to pop a little bit of local anaesthetic in here, which means afterwards Carol won't feel anything at all when that cheek filler's going in. Okay. Okay, so I'm going to start off by augmenting this cheek area on the Carol's right hand side, and I can see already that the area has gone a little bit white, which means that my local anaesthetic and adrenaline have kicked in. So I'm going to make a small hole with this little needle, which is going to give me access to insert my cannula. Carol, can you feel that?
No.
Okay. Okay, so I'm just going to insert this cannula, which proceeds down the face. Now I can move this around to any area in the face that I wish to augment and restore volume. And Carol can't feel a thing down there, can you, Carol?
No.
Good. So this injection is going in really nice and slow so that I can make sure that I'm getting just the right amount of volume in just the right place. And again, although we are trying to tighten Carol's lower eyelids using some fractional laser, a little bit of filler in that junction line between the lid and the cheek will also help to rejuvenate the under eye area. And as you can see, Carol's not flinching an inch, which I'm assuming means she's nice and comfortable. Is that right?
Mm-hmm.
Okay. And that's the first cheek done. So we've just completed the first side of the cheek filling, and you can see Carol doesn't have a big cheekbone. We've not given her a big cheek, we've just taken away some of the skin laxity by restoring some of the volume underneath the cheek. And this side of the face just looks a little bit more lifted, a little bit more toned than this side, where we still look as though there is a bit of sagging here. Okay, so I'm now just going to repeat the procedure on the other side. So this small needle just makes an entry point where I can put this blunt tip cannula down through the fatty layers of the face where I want to restore those pockets of volume loss. And I can now feel that I'm in the right tissue plane where I want to be. Okay, and that's both sides now done. Now the last thing that I'm going to do is just use a little makeup wipe and the moisture on it for a bit of, to help me massage and ensure that the product is nice and smooth. And I don't know if you can see that in the video already, but already the cheek area just looks nice and lifted. But the important thing to note is that she doesn't have any scary big fake looking cheekbones. It's nice and soft and natural. So now I'm just going to move on to filling the lines and wrinkles, which you can see, because we've already picked this area up with some filler, this is already looking more rejuvenated. So I'm going to have to do less down here because I've already lifted this. Okay. So this area should be nice and numb because we already injected it with local anaesthetic nerve block. And we don't need to do very much here at all, because we still want to have some contour between the upper lip and the cheek. If you flatten out the nasolabial fold completely, it doesn't look natural. And again, you can see there's virtually no blood loss. So we're going to get very minimal, if any, bruising at all. And then injecting from this side, I'm just going to inject that pre-gel sulcus help smooth the transition between the lower cheek and the chin area. Okay. And that's the injections now complete. All I need to do now is clean up Carol's face. So that takes us to the end of the procedure. As you can see, there has been virtually no bruising or swelling for Carol. She can go straight back to her immediate activities and everything looks nice and symmetrical. The face looks slightly lifted. The depth of lines and wrinkles are reduced, but the face still looks nice and smooth and natural.